All right, everybody. Thanks for joining. We have a couple people here in Philadelphia. We're going to start off going over. Well, let me give you everybody a brief overview for new people. First, Optonome was built while I was running my own home healthcare agency. Shanita actually known me while I was running my agency, so she's here right now. Yeah, you stopped at the office before, I believe. Yeah. So she's actually known me while I was up and running. So for those people that think that this was just a random idea that I put together, there's an actual person that was here and came to my office before. So I'm also a computer engineer and a researcher that I'm using my skill set that I learned from the federal government while I research patents to help healthcare professionals like you all get up and running. Because each state has similar regulations, but it's really hard to find. So I'm using my search skills that I learned where I used to search all over the world for different types of inventions to help bring together and sort to help guide you through the process to become a licensed provider. Unfortunately, I had to do it myself, and it took me about a year or two to get through this process. So if you're able to get through it in 6 to 9 months, that's amazing, or even sooner. And you're able. I guide you where you are progressing the most frugal way possible. And for most people, it can't get any cheaper because consultant companies charge $15,000, $20,000, $30,000 for one payer. And the goal for me is I'm a heavy advocate for adults with autism and intellectual disabilities because with the right supports, they can really thrive in the community. And unfortunately, healthcare professionals are missing because they're working for these employers. And these employers would only put you into to provide a service if they can bill for it. So unfortunately, your services are not added to most plans because it's a little bit more expensive because your skills are again, more expensive and will only be added if it's really needed. So if you're the CEO, though, you can offer your insight to your staff and they can help you document additional information so your consumers could receive the best or top quality care. And once you're at the beginning, which is what you're going through, like you're starting off with non-medical services. You don't start off on the medical side. You start off with non-medical services so you can get you can understand the delivery model, how the DSPs would become trained, and then how they would go out into the community, provide a service, clock in and out, document what happened that day, and then you're able to bill as a result. And so that entire process, the Optonome software manages that entire workflow, right? Even before that service starts. When you first receive that referral, we're able to review the ISP and be able to put together customized training for the DSP so that they could further understand the needs of the consumer. Most agencies, they do this manually, and it costs them a lot of money because there's continuous turnover. So literally for one consumer, you could very well train 10, 20 staff over a year time. And imagine if you have 30, 40 consumers. That's why they literally dedicate staff to this process and why it costs so much. So my focus was to create a training program called DSP 123, where we train and assess a potential staff member to start providing services, or anybody in the general public, where they could start to provide services based on the state regulations because each state is different. And if your agency is also in the system, we're able to use that ISP ISP and train them directly without user intervention, with HIPAA compliance. And that's where the unique offer in Optonome comes in, because if you're able to recruit and train someone and then further train them based on the consumer's needs, you're saving about $4,000 before you even start providing services. So that's the unique model of Optonome and how you can build that advantage to have more net profits.
And it's also good for us too, like in terms of they're fully trained. So like if anything that they would do, it would fall back on them.
Right. So Shayna's just mentioned the fact that a lot of these agencies, like, I mean, I don't like talking about Elwin, but I do like talking about Elwin because they get all the contracts. And the systems or the tools that they use right now are not the best. And most of the staff, like if we do a Google search on Elwin, you'll see staff that are going to jail or committing fraud, and it falls on them because they're not properly trained or the right systems are not in place to really make sure that they're not doing or dealing in those types of activities that would get them in jail or something like that. So that's one reason why electronic visit verification is mandatory now. So whatever's billed, we know that this person clocked in at this location, clocked out at this location. But there's still a lot of room for error in there, especially for like someone with an ISP that requires, in 24-hour care, requires someone to check up on them every 15 minutes. There's no real way of making sure that they are in that room or knocked on that door or checked in on that person at that time. All right. So that's where we incorporated sensors. I believe I have one here today that detects where the staff member is, which room that they're in, and there's a documentation timestamp of where they are in that home. Right. So you're able to correlate that with the actual ISP. If anybody has a question, you're able to show them that data. And as you can see here, this is Dr. Nish, who invented our learning management system that is now built into Optonome, and it changes the content so that the staff member or whoever wants to be trained can understand what's being taught to them. And so, as you start to hire a lot of staff, you'll soon realize that they all have different types of training levels. Some could be literally straight out of college. Some could have graduated college, and still you ask them early on before they are able to go out in the field. And this allows us to have the data that's necessary to make that decision, right? We pre-screen and create a profile for you for that potential staff member so you can make that final decision before they go out into the field. Right. The 6400 smart home is related to 24-hour care, and I designed it after the 6400 regulation for 24-hour services. So it's the actual regulation in Pennsylvania that requires a home to have certain standards. And I can actually show you guys the different standards, but one of the standards could be a emergency list right there on the wall or something like that, or a locked cabinet in the kitchen where poisonous materials need to be stored, or a first aid kit that is stored in a certain area, or on-site orientation for every staff that's providing services to that consumer. You know, these types of details need to be documented every single way, and Optonome takes care of that. So this is an example of, I don't know if you could see it right here. So these are actually real homes. This one was in Allentown. This was on 48th and this one was on 48th and Hazel. This one is not too far from here. 60th and Malvern or something like that. So these were 3 different sites, 24-hour care, 3 different locations where we were able to remotely monitor and make sure that they were in compliance at all times.
Oh, if you guys are wondering, like the rooms are being like utilized
I
because
yeah.
since like I'm not generating revenue. You just heard a baby. I was like, well, that was Dennis.
Yeah, that's my daughter's upstairs. So that's my daughter.
with your dad.
Yeah, my dad's
Yeah.
upstairs. Yeah.
You incorporated the 6400 regulations on the town website?
Yes. So I could like show it to you.
But also 2 rooms are now being rented out upstairs, and then the Airbnb in the back is being utilized.
Yes. So this is probably the most occupied it's been. So it's currently generating about 3,000 a month right now. So it's supposed to be self-sustaining. So it's just self-sustaining right now. So we have Airbnb, 2 tenants, and still have about 4 rooms available.
You contracted out any emergency, any travelers?
Yeah, we could, definitely could. Yeah.
Yeah.
All right, so I'm bringing up the actual regulations for 6400 right now. Let me share it with people. I hear myself. All right. All right, so 6400. So this is literally each regulation. Let's heat sources or poisonous materials. All right. So something like this, someone has to check on the poisonous materials, check off on it, and sign off. Where we can add an additional option where they take a picture and sign off, where the timestamp will show the actual location inside the home of where this was actually submitted. Right. So we're able to say after a month time frame, be able to push this out to 1 staff member a week, and now have an audit trail where this is checked up on over a month period. So after maybe 6 months, you'll be able to see like an asset or a room and how it's progressed or how it depreciated or how it stayed the same with a specific staff member or anything of the like.
Do you guys have any questions on this?
Oh, it's pretty cool. I like the automation of it.
Yeah.
So you don't have to physically come here and check off these regulations. The staff's basically doing it for you as part of their job.
Right, and believe it or not, they're like, I'm not sure why most of DSPs weren't taught these regulations, but for some reason, maybe it's because the technology wasn't there before. Literally, if you look at this in a binder, the binder is like this big. So typical DSP is not going to remember it. Now with technology, it becomes easier. They just have to walk or do their job and get a notification to do an extra task. And it helps ensure the health and safety of the consumer. So that's the 6400. This is the on-site orientation, where every new staff member that's providing services will receive on-site orientation, where after the first staff member, they have to shadow someone to get it to actually document that this person understands what they're doing, and then they complete this at the same time. So they're guided using their smart device to complete these different steps. So sleeping procedures of the consumer, behavioral plans, special protocols, location of medications, fire evacuation procedures, all these different details that's required. So this is all related to 6400, which you're about to be doing.
And they're going to download this from like the Apple Store or,
Well, they can access this through the app right now.
oh, okay.
Is it a web app or is it?
They can access this through the web version right now.
Okay.
Mhm.
And does it send like push notifications to them whenever?
Yeah, this is
they
a push notification based on their location. Cool. All right, so I actually didn't plan on going this deep dive into these regulations. So, any questions, Keisha? I know I kind of went on a tangent there, but I wanted to, just finish out the features of the application so you could see or understand a little bit about what it offers. So let me go back. Protection of food. A lot of the time, so another times, a lot of allegations come from protection of food. Someone like the consumer or a family member could come in and look into the refrigerator and sees some food in a freezer and that it's not in some type of like the right bag or something like that, or it's not labeled. So we have staff that make sure double check this stuff. The Life Skills 24/7 is for, it's also a Fresh Start program. I called it Life Skills 24/7 because the consumers want to be more independent, and they don't want to have staff all the time. They want to have staff maybe just a couple hours a day to help them around the home or help them get that job opportunity with some type of affordable housing option. So I called it Life Skills 24/7, but at the time I was running my agency, it was also called the Fresh Start program. And this is how it looks, where that background is actually a live screen that the actual consumer could be guided to complete steps on their own. And you as an agency owner could also oversee what they're doing as well as their family, and they could support them remotely. So this helped them try to do tasks on their own where they're also timed, and so that they can try to improve their time over time. More of a gamification type component to trying to achieve their goals. A lot of people don't know what gamification means. Sorry about that. So gamification is like doing a task, but in a gamed or fun way, like a game. So instead of just maybe doing laundry, maybe you get some points for doing each step of the laundry task, and then maybe you or a family member could incentivize them to do that. So this shows them the steps that are coming up, where they're able to complete it, and based on their location, they're still using an Optonome application, so we're able to verify where they are inside the home or where that task usually is supposed to be completed. This is the last one as far as features. I haven't really talked about the meal plans and the types of offerings the DSPs can introduce to the consumers. And we were able to integrate a food database where it could be customized based on the individual's support plan, because a lot of people have allergies, different types of doctor's orders, and you want to present those food options to the consumer. And is that him right here? You could come down. He wants to come down. That's so funny. He's just watching me. Yeah, so to be able to present different types of food options to the consumer so that they can make the choice and decide on their own what they want to eat, and if they want to participate in that meal offering, maybe they want to cook that meal, or maybe they want to go grocery shopping for that meal. It gives them the opportunity to do things on their own. And this is definitely important when it comes to 24-hour care too. Go on.
Hey.
We were just talking about the features of Kyle, let me grab you.
Hi, hello. What's up? You just want to run around? It's past your nap time. Where is he going? How you doing? Welcome.
Hi,
I'm Dennis. Nice to meet you.
Teresa.
Okay, cool.
Started like a week ago.
Yeah,
Yeah.
yeah,
You drove up here.
yeah, from North Carolina.
Wow.
Yeah.
Holy cow.
Thank you.
We need a water. Oh my gosh. We got water, we got pizza, we have cookies.
Yeah, the pizza.
Holy
Cool.
cow. You should have told, I should have told Julian. Julian's, sorry. Well, he's been going through there.
Again, those who are joining, thanks for joining.
Yeah.
How long did it take you?
I'm going to take a 5-minute break here, and then I'm going to go into the non-medical and medical service options. Right?
That's good. We have to spend some time. Dennis there afterwards. But, so this is Oleg.
Oh, nice to meet you.
Name's Arthur.
Nice to meet you. Nice to meet you. Keisha and Shanita. Nice to meet you guys.
So,
Are y'all off on building? Okay.
we're off in Berlin.
Okay. I found that that's pretty close to here.
Yeah, it is.
Yeah.
Right up the line.
Yeah. So 2 PTs, OT, and then 2 nurses.
I'm OT.
OT.
Cool.
Yeah, what are you doing now?
Oh, I'm on a travel assignment
Oh, okay.
in North Carolina.
Oh, yeah, because you're from Texas.
Yeah.
Yes,
Yeah.
yep, it's all coming back to me.
Yeah.
You were traveling.
Yeah.
What part?
Yeah, so this was no big deal.
Airbnb here.
Oh, man. I might need to dress the shit later.
That would be good.
Mhm.
That would be good.
Yeah,
I'd
I
rather
really
have travel. I'm from Houston.
Yeah, just like sitting there. Well, it's
I'm gonna start.
what else? Just,
Yeah.
yeah, no, you're.
Yeah, so this is the home.
I think that's probably PT.
So right now, my service
Yeah,
is
this
starting
morning I
now,
was
but
helping my brother tear off kitchen cabinets.
2 people
So I
upstairs
just came from
are
that.
living
That's
in
always
the
fun.
Yeah.
back there.
It's the toughest job.
No, I floor.
Like the
Physically.
Wow.
I think
And I didn't know
like
until just now.
moving.
Did you-
That is not that bad. Like, I can
Okay, then do it for a day.
Okay.
Yeah.
Oh,
Like
do it
a
for a
moving
day.
job.
Yeah.
Or like an
Yeah.
actual job.
Oh,
And then you have
yeah.
a couple jobs a day.
Yeah, I would say
You have to
here.
move a house.
Oh,
Like,
that's-
you're moving what?
Yeah, that's tough. I would say like
That
here,
and-
warehouse.
Or that and,
Now I came,
toughest job I had.
yeah, back and drink that back there.
Selling.
No, I haven't.
Cause I had to unload the truck that
We're
came
still
in.
just like,
There's an 18
until my
wheeler
services
full of
start.
6-foot trees
Let
that
it
were
be,
frozen.
and then
Yeah,
once
I don't think I ever had to
services
do
come in.
anything like that. I know it
That's when I was like
was
19 years old.
for you.
No, so
And
I'm
then for
starting
3
with
hours, the
caution.
guy gave me $13.
So like in Pennsylvania,
Oh,
there's 2 waivers, the
Oh,
autism waiver for
that's rough.
autism.
That's-
And
Yeah, there we
consolidated
go.
waiver, which is
The tiny
intellectual
needles kind of
disability.
poke you all around too.
So your waiver program may be a little bit different than Dennis
Twice the
waiver
size
for all
of
that,
it.
but from autism waiver first.
Okay.
You have to
I had
have
to hard.
Yeah, exactly.
I kept going.
Yeah.
This kid was 6 foot tall.
Holy
Frozen.
cow.
So community
Good
inclusion
for you,
services
man.
allows
Well,
you
now
to
you don't have to ever do
to
that
bill
unless
for
it's unless you do it for fun.
independent public transportation.
No, it wasn't all that
Cooking,
bad.
cleaning,
It's more to-
all that, because
But it was
bill
fun.
we gotta keep.
I know
Those are
it's
teachers
really
life
tough.
skills.
I said
But I've already reached out to like the sports coordinator, so I did that this week.
So when did you first
The
like sign
work
up
involved.
getting everything started?
Well,
Is-
we were the slowest,
I mean,
so
imagine
I
doing
got
this,
started
let's say you have
like in the summer
$30
of last year, but
Imagine
it's like
doing this
super
for
fast.
I break my back.
or much faster.
the
So
machine
like
weighs 120
just so
pounds,
just
going
because she's
to
a
Westfield, home.
started in
That was-
Pittsburgh,
yeah, that
and
was-
from where
Yeah,
she's
you don't
right
need to
But I
now,
haven't, I
I think
actually
she's
haven't
one
gone
month
into
in,
that work.
is where it was like 145. So
That's
it's like
good.
a lot faster.
That's
Just because of the area.
There we go.
No, it's because Dennis is progressing everyone way faster. So, oh, like, well, like the courses that I
So
took.
it's gonna be less value, it's gonna be more value in Philadelphia versus Pittsburgh, so, the state probably sent her back to Pittsburgh faster than here.
No, like she went through Spectrum 2.0, supported employment, skill builder, like she went through that within a month and Dennis
Wow.
started sending out like her paperwork.
Holy cow.
Yeah,
Wow.
yeah,
Training courses.
Yeah,
yeah.
she
Whereas
was-
for me, and that was like what, 4 or 5 when I was up to like skill builder
Yeah.
and stuff like that. But we were just the first group, so we were slower.
Yeah.
That's all right.
Depends how much time you have too.
It's true.
Time.
Yeah, it's true. She wasn't working at the time when she spent all this.
We did the skill
Yeah.
builder, we did Spectrum 2.0.
Yeah.
and
So you
I
think that's the hardest, the
think
longest
that's-
part, just getting to the trainings and
So
stuff?
what training? Skill builder.
The longest
training,
part is just
and then
waiting.
Spectrum 2.0.
Right, Shanita?
Mhm.
It's just waiting for
Yeah.
your state to approve.
Yeah.
So like the one
It's
we
like-
were put in November, like because I'm in Philly,
That one was the
where
one
we're
that's
in Philly,
really
it's
a
just
lot.
slower.
Yeah.
Autism one.
Autism, yeah.
Because
Because we're consolidated,
That one,
so
that
we-
one was
Spectrum
Spectrum
2.0?
Yeah, that one,
Yeah.
that one
That was
video.
But even on the
Yeah,
geriatric side, on my side,
And then the cognitive
it
one.
took me 6 months for everything.
Oh, really?
And
I mean, it was like a
you're,
process,
like,
but it was still 6 months. So it was like kind of normal.
I said the skill builder.
Yeah.
And skill
I
better one
felt
is
like
the
it.
toughest. 'Cause they give
Yeah,
you
well,
assignments.
yeah, that
Yeah, and then they work,
I
They
think
get graded.
exactly, you have to fill out like a sample.
and I got the paperwork back at the end of
Mhm.
For example, like
January.
plan, like
So
a skill builder plan.
Yeah, it's like an implementation plan, you
Or
have to
pretend.
break it down in
Yeah,
quarters,
or
of what
pretend
you plan to
to
achieve with these goals.
Really?
No.
So,
I
and
know.
then you have to send
That's
it in, and you
cool,
come
though.
back and you critique it.
But
First
how
time,
It's
okay.
like over
We
20
sent-
minutes.
we-
it's
I
we
like-
failed
got-
the first.
Oh,
Yeah,
um,
we got the first time, and then we just resubmitted
she's
it,
in,
so.
yeah, she's in,
It depends who grades it.
Yeah,
Whoever
the guy who
gets
graded
Oh,
mine, he did not give a crap, he was ready to ship out for the day. Hello.
They watched, I heard it was a baby, like her age.
Oh.
She's so cute.
Hi, Sarah.
Didn't drink for nothing.
How old is she?
I know, right?
Mhm.
What is she?
Yes, I know. That's so bummer. Like, right? And then you beat yeah,
Cool.
I hope they'll come back up soon.
Alright, team.
Yeah, like that last time.
We have pizza over there.
Yeah, I'll get that out. You can also do, housework if you wanted to, Dennis.
Yeah. The Airbnb is back there, but somebody's in there
Yeah.
until tomorrow. 2 tenants are upstairs in the suite.
I'll be out of here.
We have 2 other homes over there. So one directly across the street and then 2 doors down that way.
Okay.
So that's the hub.
Brings me to
You want to have at least 10 rooms available for a hub so people could, spread out and be able to offer some type of housing options to people. So, for example, one guy here, he's a veteran. And the one lady, she's like planning to retire soon. So it like works for them because they're on fixed incomes or about to be on fixed incomes. So this is really attractive for them long term. So that's the goal, to try to offer these types of housing options to people that, want to live close to family or, want to save on money, save long term. So these hub properties, with knowing that all of this entire West Philadelphia area, as well as Southwest Philadelphia, there are hundreds of homes available that are affordable. So if Shana wants to expand south, or Shanita wants to add a hub in this area, you guys have your hub close to Upper Darby, you'll have tons of opportunities to expand because of the housing options, especially in Philadelphia. I'm pretty sure we can still find homes in the 50,000 range. So it's dirt cheap.
And are you looking for like specific, let's say the single home properties or row home, it doesn't matter to you?
No, if they're that cheap, you could put one person in there.
Mhm.
If they're 50,000, you can put one person in there. That's what I do.
If it's 24 hour or. is that what you're
24
thinking?
hour, or if you're we'll talk about the PACE organization, but like for a PACE organization, someone, CMS, they pay $3,500 per person per month. Yeah, and you take care of them, everything that they need, OT, PT, whatever. And so you'll be profitable to be able to offer some type
At
of
a $50,000 home.
right.
Yeah.
That's what I'm saying. So it's definitely affordable, and no PACE organizations offer affordable housing.
Right.
So that's why I was like, let's talk about the PACE organizations today, so people can understand the opportunity.
I have a question, Dennis.
Sure.
While I was working hard all week on these modules.
Yeah, no, you're like, let's figure this out.
Something came up and I was curious. There was this statement here, if you can read the,
Sure.
I can read it out loud. I just curious. And I thought, well, this is kind of what we're trying to achieve here.
It is the most. Yeah. The 6,400, what I just was talking about.
Well, so they're saying that they're trying to prevent clustering. We're creating.
No, so,
Or am I not understanding?
yeah, so I know the lady who actually approves the sites. So they don't want it to be on campus. They don't want it to be side by side.
She need to worry.
They want them to be in a community setting. And this is for 24 hours. These types of homes is not for 24 hours. This is for someone that otherwise could just live anywhere, any type of apartment.
I see.
But yeah, 24-hour homes, they don't want them to be like home here, next door to each other. Because that's considered like an institution.
Yeah.
Sure.
So that's what they do.
Oh, so these aren't 24 hours, they're frozen.
Yeah, where 24 hours is considered a licensed facility.
It should, that's what the goal is.
Yeah.
Right now, I got tenants in there, they're just right now, so like everything is all clean and all that stuff.
Very nice. But
It's my first
did you say you
time,
wanted
so.
to?
Oh, you made them yourself?
Yeah. that's
Yeah,
what I
the last time there were brownies. They were pretty good.
Avocado brownie.
Avocado brownies.
Oh, yeah, no butter at all, but it tastes like the butter. So good. Yeah. So good. You know,
Anything
something-
homemade.
Oh, yeah. Anything pizza I'm all about.
You want to send this my.
Anything pizza.
You know what I mean?
Mm.
I
Oh, you
think
got that
versus,
little
like,
crust
tries to
going
do,
on?
like, so well. I'm starting out that way.
Well
so
done.
The 24 hours, apparently for me, I feel like I need to like learn some skills before jumping into that, but nursing, like, I feel like.
So was that your son?
It's true.
Yeah.
You know,
I'm trying to get him to take his nap, so I'll put her down here.
And for being a nurse, if you're not directly going out there, you still feel the hospital, like things like that, so we don't have to each other.
I've noticed in, with Bayana.
Okay.
For your,
I got one pair,
are they limiting?
Yeah, okay.
Oh, yeah.
and I've been doing it
House,
since October.
Well, actually, they don't limit out of visits, but they cut our guaranteed
State of Pennsylvania, well,
visits from 30 to 25.
saturated with.
So before, they used to say, hey, come to the office, get the extra 5 visits by doing, visit work.
No, we didn't know.
And we used to just sit there, do whatever they asked us to do,
I started my
whatever.
whatever.
And then they were like, okay, we're starting probably, there's no losing money off that, of course.
Something I started.
'Cause
Yeah.
they
I still
were
have
busy, and then they were like, you know, we're just gonna cut you off 25 visits, which is like 33 hours a week.
Just with, older
And then
patients versus,
With that,
intellectual
our
disabilities.
PTO
So it's just
accrual
the
is
general
also passed.
population.
Our holiday pay goes to 8 hours. And
How's the
our 8 hour
administrative
day is
full time?
66, full-time with us.
Oh, so
It's
you're
not
a full-time
bad,
home.
it actually is.
Full-time home PT, yeah.
Salary, okay.
Yes,
I got
but
it.
then they basically cut down on the hours, all the business.
If you run your business right,
They basically cut down too, because instead of 8 hours, paid hours, they're
and only
6
reason
to
I
6
kind of say that too is because,
6 hours.
like I said, Pennsylvania.
The house
will allow you to
shows,
let their
Let me ask you
take
this.
care of them, so
Yeah.
it's
is
more
Fox
so,
involved?
a lot of stuff we don't got. It just depends on who's taking care of them, who's on the Fox,
We could, yeah.
so.
Well,
So
not
it's
like,
mine is more
what
tested,
if
but
my
it does
family does it, cause I was thinking my husband, how stressful it is when you have to call out or things like
Right.
that.
Yeah.
So that could be
Yeah,
you.
yeah,
That could be you.
call out.
Exactly, so,
Is it all like
Let's see.
family?
like dynamic
With
physical
with
therapy,
your
rock and roll type, who, you know,
90%.
there's that mix between
Okay. and yeah,
Oh, I think
that's
it's
super
probably
low.
outpatient.
So like, well,
Yeah, we can't keep on going with these like med aid treatments, right?
Oh, they were here.
But we can,
And
you know,
you
they
go
would
over
need a
there
lot
one
more
day.
time, so
But
for the
They don't
dynamic
have one.
physical
Every
therapy,
family member
like
like
outpatient.
Now, how much do they get per hour?
And Fox, I mean, that's what we just
Well,
give it to most
that's why I told you
doctors.
to shop around.
Mhm.
Geriatric
So the
patients.
state, they used to pay 1950 tomorrow, but now they want
I
like
know, I thought it.
Get it done. It's you.
I should, I just don't have that.
So we basically,
If you,
how many hours they
if
did.
you ask me, I'll help you.
Oh, that'd
You'll
be
get it
great,
done.
yeah.
That's a big factor.
It'll
How
be
many
done,
hours they did.
I have a biller
If
for you.
somebody did less hours than.
You can literally be your own.
Have you thought about using like their PT? I saw that floating around.
No, so I'm
Like,
using,
like,
so I'm using quick
How many hours
and
they get, if somebody's
QMR.
getting overtime or if it's 40
And
hours.
the other thing is I have OT, another PT and two
Oh, yeah.
PTAs that are also using quick
The
QMR.
majority of my.
So it's the cheapest to
Yeah.
maintain.
It would integrate great with this type of, stuff too.
Yeah, so it's hard to like
If the
get
internet
it
up.
because you can hack off at night.
But if you ever want to, I mean,
Get a certain amount of hours, you get overtime, because y'all
or
don't,
I
and
create an
you
escort.
don't wanna have nobody else, like, say if you pay somebody
My
40 hours,
counsel
say, hey,
does
you
it
get somebody
in an
else,
hour
you know, pay them the overtime, but they don't want it, because they don't want that particular
Yeah,
person.
so
All right, well, that's,
So-
you're not gonna get 70
literally in an
hours.
hour I had paperwork.
And
When you
they're gonna
pay
pay
escrow,
another
you have
50 hours.
to
So what we do
have
is,
like criteria
So
that
when they
you meet
know,
every year to maintain
I'll
their
lower the fee
escort
rate.
status, like
somebody lower the
quarterly
fee rate,
meetings.
so say somebody get paid
annual
like $11
meetings,
an
something like that.
I've
mean,
had an
You
escort
lower
for
the fee
4
rate down
years.
like
I haven't had
$9,
to do that.
like
I was just reading like
I lowered
about
the
the
escort
different
down,
rates.
escort
depending on how
is
many hours they get, so for instance, I'm pricing like at 70,
As
I
you
lowered it
have
down
the
to
K1
931. so you get 931, 40 hours, and then
an
whatever
extra
overtime is,
50%
but it all equals
deduction.
$11 per time.
So, for contractors, which,
Cause the state doesn't pay overtime, the state don't pay for time and a half, none of that stuff.
No, but don't,
um,
but do you have to because it's your staff that.
That's the time and
Yeah.
half, it's a state law.
Because
So if you get a certain, if you get over 40
I-
hours,
Yes.
you're
yeah,
not forced
yeah, I
to
think,
person that come help take care
I
of it.
mean, but I would be transparent with IATA
Yeah.
and be like, look,
But is that
I
common,
have
we
my
didn't
own-
have many hours for a person?
No, I would refer, like, because I also do
I
PRN,
got somebody who's
at
94
Del
hours,
Carmen
like
Hospital.
70, I got a couple
So
people that got
I've
70, I got a couple people
multiple
that got
patients there to work with me
63,
over there,
58.
which is,
Those amount of hours
I mean,
got
sure,
40,
here for Delaware
40, and I
County,
just, actually, I
it
think
gives
that
me hours there, but at the
so I
same
just
time,
started
I
at
can
28
be.
hours, we can just start. And usually it does start more than
Actually,
I know it's
Yeah.
scary because you don't know much about it.
No, if I knew the steps of going through it, I'd probably do it right away.
Basically,
That's-
Well, I'm a coordinator,
I
though,
have
the state.
the steps for you to take,
Uh-huh.
kind of what we
send
have
somebody
here.
out, and they'll
If
say,
you ever
assessment.
wanna do it,
So it's
just
like a
call
nurse
me
that
and
comes out and
I'll-
says,
sure.
okay.
It's actually
I'm a
quite
a
easy.
nurse, but they got 3
You
different.
hire a credentialing company to credential
It's a
you with
three-step
Medicare. And that's it.
So the very first time.
Once
we
you
had
do your
medical
Medicare,
yourself,
So,
coming out,
escorts,
you said did the application,
get the escort,
coming in, credentialing,
credentialing,
and then
and
just submit all that stuff.
then you're
and
ready to
then
bill.
So
And a
it-
biller, you need 3
And
things.
then-
You- So I
the
was
second
thinking,
person
I
come
was
out,
thinking
they like
back
3
a
different
lot.
companies,
I was
all in
just
one, like they was all the,
first.
the PAIB, independent.
Because- Yeah, because I mean, we're
Um,
skilled people, right?
The
We know
third
what
one,
we're doing,
will
and
tell you how
it's
many
one of
hours
those,
they get, but now I heard
effective
it's
having
like
patients don't want
computerized.
you.
Like you say, this
Right,
person got
yeah,
this,
yeah,
they
yeah.
point for this, it's like.
They
it's
wouldn't
just-
bother you,
Yeah,
that's
that's
why
what
they're
I
like,
think.
okay, they're
Yeah.
IATA.
Almost be invaluable to IATA.
Coming
Think
up
about it. Right, if they had an in-house, I mean, they might be
But
like,
I
look,
got somebody who got.
No, you're right, because like, all right, so they do
You got
Medicaid,
58
right,
hours,
after
you
they discharge,
You
you
be
do Medicaid. We
basically
keep
means
out,
like.
I don't know, we refer them back to
you
VA.
keep them with IATA.
Double shift,
Exactly, so it's
because I
gonna
was
be
sleeping
a
out,
partnership.
and they won't raise it.
Hi.
Escort,
And then you got
credentialing,
to just walk around like
billers,
this.
and
And they
They
got
got all this out, they
Yeah.
got
Oh, quick
Yeah.
EMRs.
So, looking more, that's obviously your EMR system.
Yeah.
You go
So
with
who are your
electronic.
parents then?
It's like-
Nike,
It's like the
private,
Craigslist
or
of
private,
EMRs, it's
no.
very like
Oh, I'm Medicaid.
nine,
Nike. So you don't go
2005
through
looking.
Medicare.
It doesn't have like
Oh,
a
so
really
now they, so now
nice,
Medicare, so somebody got Medicaid, well, Medicare pays for it, and then Medicaid to pick up what they got.
What, so what does,
So they can
compare
pay
to
for more
the
hours.
rest, I mean, I know you look at the most important.
Yeah, but I don't determine.
Yeah. yeah, so
Miko, what's up?
the other guys are
Like I said, it's
incorporating,
computerized now, so whatever the coordinator puts in.
billing is
And
like
then they have to get it,
We in Philly, we got a meetup today.
and then they'll call.
Some CEOs, so I decided to go live.
Every percent, yeah, right.
Because for
No,
us, in
it's-
terms of our side, like, if that's what this.
Well, right, so I literally just switched over.
We have a Facebook group that almost has about 1,000 CEO, potential CEOs in there. So we're also live in there.
So before.
So please join us. Today I'm about to go over PACE organization. It's for older adults that are 55 and older. So as you start your agency using Optonome, you'll be qualified for a PACE organization.
And then they're asking, now they asking for everybody's bank statements, and
one called Railroad
they're giving
Medicare.
more problems to get it
People
versus
who
not.
work for the railroad system, at some point, they have a differential Medicare.
Yeah, but they got people
I
who,
had no idea.
but now,
She figured it
well,
out.
not now, but if you own a house, if you're saying you own a house, they're not gonna pay you, so they
Bill
want you to
our
sign a house.
place, quick,
I know,
it's like 5 things. And they're done.
I mean, it's like that with
Sequential.
nursing homes and assisted living.
Where you get it
That's-
versus like your.
My referrals came from what, so I'm in the
Same with
little
home care.
situation where I am bilingual.
So you better off just having somebody else.
And I live in the motion.
If somebody else is going to do
Oh,
it.
So a lot of the Russian.
Word of mouth.
Yeah.
If you're-
Cool, join in.
I also.
I'll be going over a little bit more about the non-medical services and the medical services
And I don't have
shortly.
papers that. Yeah, if you bother.
They're just talking on this side, so I'm just giving them another couple of minutes.
Because what happens
Exactly
if
where
they
you're at.
then need to go to a
I
nursing
see.
home?
Interesting.
Or,
Well, I don't know how to say it.
because they already sold their house, because
No,
in my
because
mind,
it's
the
really
nursing
just
home,
not accountable.
you sell your house for the
And
nursing home.
then you just
But they already
benefit
sold it to
from
home
one
care.
on the team.
Mhm.
That's cool.
I mean, I guess the state just continues to kind of,
I'll have to do one.
Cool. So what did I leave out, or where should I start now? I could briefly go over the different types of, I guess, the growth plan that's in the business plan that I share with people. I think that could help everyone understand and bring more questions about the business plan. That business plan, I worked on it for many years while I was running my agency. I used a site called, is it Big Plan, something like that? But it's a site that people use or companies use to help them form their business plans. So when I was putting it together, it included the technology aspect as well as the service aspect to help people, to show whoever's reading the business plan that you're able to scale in a much more efficient way using technology. And so when I share the business plans with people, it's to give you an idea of the non-medical service side when you start to provide services to adults with disabilities and autism, and then the potential to expand into medical services. Most business plans do not include PACE organizations or the ability to really provide more services to older adults. It's focused on the Medicaid side. And so on the business plan, it talks about the program specialist, which is a regulation requirement to oversee the 24-hour care. And in the state of Pennsylvania, it's the consolidated waiver. That's the pretty big budget, is about $1 billion to help those that are in an institution or hospital transition into a community, because it's a third of the expense. So that's what I focused on, because that's where all the referrals were. And I wanted to really get the experience of really understand what's so hard about it if you're doing it right, because most of the people are doing it wrong. So imagine if you're actually doing it right. As you start to get authorized for services, we establish that niche offering, which is adults with disabilities and autism, because 90% of them are unemployed. So like in the state of Pennsylvania, even though they have these supportive employment trainings, you got to find somebody that's going to hire them. If the business is not going to hire them, you could do all the training you want. When I started to join all these family groups and start to talk about how they're finding jobs for their family members. And the bottom line is, these businesses, you can't depend on them. You gotta initiate the business yourself if you're looking for something long term, and you know long term that your son or daughter or family member has a disability. So they started talking about small businesses, a cookie shop or ice cream shop, coffee shop, maybe a burger joint. These are simple tasks that with assistance you could pretty much do. Burger joints are starting to be automated, unfortunately, and people are buying from them. So if you have one in your local community that's run by somebody with disabilities, I'm pretty sure people would, with the proper oversight or management, I'm pretty sure people would come to it. And that's when I start to share my experience with 10,000 small businesses, Goldman Sachs, 10,000 small businesses. I was a part of a group of nothing but small businesses where they were thriving, $1 million plus, where they have heavy experience in the small business world, in a network where we can ask questions on how to start a business or how to develop that brand if we were to start some type of small business for the consumer. And so with that type of approach, we're pretty confident in helping each one of you establish a small business if you want, or have the consumer, with the help of their family, establish a small business so that they can possibly pay for their long-term care. Something like that is not even close to being, not even close to being created these days. So that's really where a lot of families want, because they know that they can't pay for it, and they know that there's a small business that they can use those profits to pay for long-term care. So with your agency, you're able to oversee it. You're able to oversee it because you are using the technology that not only manages the care of the consumer, but can guide them to complete tasks. So if there are little tasks that they have to complete to maintain the job, or to supervise another staff member, it could be all in the palm of their hand, if they could follow step by step. So something like this has been tested many years. It's not novel at all. So all you're doing is you're implementing it at scale or in your local community the right way.
Did you guys have any ideas for like your businesses that your adults with disabilities could be doing? I was just curious.
The options are endless. It could be any small business. It could be a car wash.
I thought it was really cool that someone on the group said, produce and like having, it was a rural area this person was talking about, but like having like a chicken coop and like selling the eggs and the produce maybe around the house. I was like, that's a really cool
Right.
idea.
Right. I just wanted to put in the infrastructure in place. So whatever you decide with your creative minds, you'll be able to do that. If you're interested in starting that small business for your, most regulations don't allow you to actually own the business and provide the support of employment. So it'll have to be something separate from your agency. And so that's why in this type of setting like this home, the actual Airbnb is totally separate from Shayna's business. She doesn't own the Airbnb. She doesn't get profits from the Airbnb. But her consumers will be able to provide a service at that Airbnb where they can get paid some type of livable wage.
Like maintenance of the Airbnb.
Exactly.
Flipping it over.
Exactly. The check-in and check-out process. A simple task where
Learning hospitality skills and the social interactions too. Like they want to live in an apartment by themselves, and they need to learn how to interact with random people. So it knocks out like working on social skills and support employment.
Right. So that's the non-medical service side. Everyone that gets up and running, use Optonome, we try to establish a hub and offer some type of unique opportunity for a job for the consumer, because all the consumers, 90% of them are unemployed. You want to be able to, since you're new on the block with your new agency, you want to give them some type of, you want to distinguish yourself. And the best way to do that is to give them something that other agencies can't provide. Affordable housing, a job. That's the best thing yet. On top of your clinical oversight. Me just saying it blows me away because it's just amazing. Like I can't believe like we're doing this. But yeah, it's amazing.
I mean, I say it all the time, but I feel like we're literally going to change healthcare. I really feel that way. Like this is
Yeah, it's definitely cool. So once you're start to become authorized for services, the first two services that we try to get you approved for is the supportive employment and community inclusion services. Because with those two services, you could very well get consumers that are receiving 20 to 40 hours a week, or maybe even 50 in Pennsylvania, of a mixture of community inclusion and supportive employment, like 20 hours a week supportive employment, 20 hours community inclusion. And that type of service offering, you'll net maybe between $2,000 and $4,000, where you'll be able to take some of that money and subsidize their housing, offer livable wages to your staff, things like that. So yeah, that's the first 9 months after you're up and running. We help you basically ramp up our services by marketing to the different support coordinator agencies. If you're in Pennsylvania, again, you have a major advantage because I know all of them, most of them, and especially on the autism side. But it's going to be a lot of fun as we reach out to the different states, because they all look at Pennsylvania as the leading state. So kudos to that. So once, again, that first 9 months, you start to ramp up not just non-medical services, and we add on additional services. So say if, like Oleg, you probably start on the autism side. During that 9 month period, you'll eventually become qualified in the consolidated waiver. I actually don't recommend doing consolidated waiver first because they're very unorganized, and most of the consumers do come through very outdated ISPs and things like that. So like you guys, while we're processing this, we're going to go through the autism waiver at the same time. So you probably get authorized for both payers about the same time, where you'll be authorized for autism services a lot sooner. So you'll just have more referrals coming down the pipe much sooner, which I do expect because you're a PT and OT. So again, on the non-medical side, it's just community inclusion services, supportive employment, until you're more comfortable to add additional services like 24-hour care, light medical, which includes administering medications to consumers. And so those types of services, that's where the most need is, because most states, they're trying to transition people out of institutions because it's too expensive. So you'll definitely get a lot of referrals on that side as well. So that's pretty much it on the Medicaid side. I went over the 6400 regulations earlier, which pertains to the light medical. On the older adult side, which is you need a clinical team, or you need an interdisciplinary team. And that's why I make sure at least everyone is coming to the table with one of these, fulfilling one of these requirements: PT, OT, RN, speech language pathologist, something that will be able to eliminate at least two of these options to save on costs. And so that's why it's hard for CODAs or PTAs to get started. unless they actually have somebody that could fulfill one of these roles.
What is the PACE called?
So the PACE is an alternative to a nursing home. So anybody 55 or older has the option to join a PACE organization where they pretty much would take care of you like a nursing home, but in a local community. Unfortunately, there are only about 200 or 250 PACE organizations in the entire US that are serving about 45,000 people, but over 1 million people are currently qualified. So there's a huge opportunity to create PACE organizations. The only drawback is, which I was reading on the CMS side, it's really hard to predict if they're going to allow more than one PACE organization per zip code. So I do see this expanding. Pretty much all of you could very well have a small PACE organization in your local community, but it allows someone to actually age in place with the supports of your interdisciplinary team instead of a nursing home. So they'll get supports from your team as well as their family, as well as your DSPs to make sure that they can age in place.
So is it pretty much the same thing as the personal care home?
Well, it includes like it has an entire team. I don't think a personal care home has this entire team. It is required to have a dietitian, a doctor. They actually have their doctor's visits as part of your organization. A doctor actually sees them.
Is it an actual site?
Yes.
Okay.
So the requirement is a day program or a day center where they come to that center maybe 2 to 3 times a week, where they can have PT, OT services or see their doctor once a month, something like that.
Is that Innovage?
Innovage is a
Innovage.
PACE.
Uh-huh.
PACE.
That's a
Yes.
PACE, okay.
They're the leading PACE organization in the entire US. They sold part of their organization for about 200 million a couple years ago. So they're quickly trying to expand because, like I said, if they're able to get in all these zip codes, it's going to be hard for other people to break in. So that's why I want each of you to eventually have a PACE organization. You'll have the meat and bones of it by having the home and community service side already in place, as well as having a niche offering. Most of these PACE organizations do not have the skills to support someone with disabilities or autism. Your staff would already be trained in these types of settings. So you'll have an added advantage once up and running. As you can see, there's nothing on here related to behavioral health. As we put together your interdisciplinary team for medical services, there is a requirement to achieve dean status, and that dean status would allow us to start to qualify for this type of organization. So that's the second year once up and running.
Can you go over dean status for people that may not know?
Sure. So dean status is a third-party inspection company like CHAP. So let me show everybody CHAP. So CHAP is it's like an accreditation company that they go to hospitals and make sure that they're in compliance. So because CMS can't go out to all these sites. So they have these organizations that go out and do the inspections so that they can say, okay, this person has dean status, CMS, they're okay. All right. So my partner's CHAP. I like them because they're in Alexandria. I used to live in Alexandria. That's the only reason. But no, they're known. They're known. They're known. CHAP is organization that makes sure that your policies and procedures are top notch. Just to go through their program is about $10,000. Right? So that's why we help you start to generate revenue, so we can actually pay for that expense. It's not an expense for you. Right? because my goal is so you could support more people, not go into debt. So if we're able to figure out a way so you could expand and support more people, let's do it. All right, so let's chat. See what types of I'm not gonna go into that right now. Let's stick to the PACE. Any questions on the PACE side?
So what's the timeline for trying to push towards opening up your own PACE organization?
It would be at least, we wouldn't start the process until at least a year after you start providing services. Where during that time, we'll start to put together your interdisciplinary team, start to make sure your hub or in your day center is properly located, things like that.
Is this a license?
It's a licensed facility, similar to 6400 regulations. The day center, that is.
So if we were looking on the street, if we were doing like my hub, it would be like, would it have to be a home that was, I'm thinking older adults. So would a home like this be appropriate for them, or would
It's very well possible something like this could be a day program. There's no minimum square footage. I didn't see that.
Yeah, Innovate has, right where I live, they just built like a 4-story brand new construction. I don't know, like 60,
Yeah.
apartment and so there.
Oh, really?
Yeah.
Yeah, Innovate. Check it out. I can show it to you guys, but yeah, they're the leading PACE organization across the U.S. And again, they can only support so many people. Like I said, they're only supporting 45,000 right now. This is early days.
Yeah.
This is early days. So it's a huge opportunity for you guys as you go through and get started. Over 1 million people are qualified, and as more and more people age in place, this is the best option for them. If you start to like search PACE benefits, it's going to say this is the best option to help people age in place.
Yeah, no, I prefer people to take care programs and everything right after home healthcare, because like they do offer therapy and rehab services there too.
Right.
I do that, provide therapy services in daycare centers.
Oh, cool.
Right. So you're already doing it. There you go. There you go on the joint. Right. Yeah. So you and your interdisciplinary team, you're responsible for putting together this type of plan, like the weekly, daily plan for this patient. Even like you don't want their health to decline, because if it declines in your care, you're responsible for it. So it benefits you to really give intense supports, and with your expertise, you should be able to do that. You have a nurse on hand, you have a doctor on hand, you should be able to handle it. So I actually put together like a schedule or a possible budget to see if something like this could work. So as far as the dietitian, a PACE center supervisor could also be a DSP, like a more experienced DSP. One person could fill 2 roles, right? So you could have you as the CEO also could be, what did I see here? I don't see, there was another role, but the social worker would also be like a quality assurance personnel. There's a requirement for a quality assurance personnel. So I felt like a social worker could maybe come in once a month, maybe have a phone call with them or see them once a month for about 30 minutes, something like that. The nurse is as needed. Occupational therapy, again, as needed. You could do once a week or twice a week, maybe one session, 60-minute session once a week, something like that. It's all based on your availability. So if you say you want to become available 20 hours a week, your PACE organization probably wouldn't have more than 10 or 20 patients, but that's still pretty good. 10, 20 times 3,500, it's pretty good, all right?
3,500 is like what you get for one.
Right, so-
client a month.
So they're trying to move away from fee for service, what goes into where the capitation allows the state and the government to save more money. And so through the PACE organization, I believe it's a lot of money that they're saving. I think it's about $10,000 a year or something like that. Per person. So it really benefits them to have more PACE organizations as well. Like this year alone, they're really trying to get more PACE organizations. They have open enrollment periods every quarter right now.
Are they doing the same thing on the residential side, getting rid of fee for service on the license side for the residential?
On the Medicaid, I think they're trying to figure it out, but I'm still trying to see how they're going to do it. But I don't.
Well, with PDGM, it's kind of already happening because like therapy visits aren't really being compensated that well. So it's kind of the entire package. You get paid a set fee amount for an entire 30-day period.
Right.
And then that's why they cut down therapy visits. Before I used to see, so myself and the OT, we would have 16 visits for the client between two of us. Now it's got cut down to once a week, which is 8 visits between the two of us. It's got
Right.
cut in half. And then so as the nursing visits, they got cut down in half too. So I think that's going away, and it has made us more efficient with our patients.
Right.
On the downside is that it's also limiting for the people who actually need it.
Right. Well, in a PACE organization, if you actually own it, you could provide service. Yeah, you call the shots.
Exactly.
So that's the added advantage there. So, that's the capitation rate. So right now it's about $3,500 the average across the U.S. But I do think it's going to go up more, and you're able to appeal or try to get them to increase the rate as well. And if you have someone with behavioral needs, of course, the rate is definitely going to go up.
Do you have a specific question? I know you drove all the way out from North Carolina.
It's good to meet you.
And you just started too, so I know this is a deep dive probably right now, but anything you wanted to go over with the group or chat with?
I'm just asking about the business side, like as far as establishing my LLC.
Okay. Yeah. Anything specific?
Well, like I already have an LLC
Okay.
for just providing OT services.
Okay.
So I was like, do I have to establish a separate one? I do.
Yeah.
That's
Yeah.
pretty good.
Yeah. You want to keep it separate.
Okay.
Because you're probably providing services in your personal capacity.
Yeah.
So you'll start to have staff that are, when they provide services, they represent your agency that you're billing under. So you'll need a separate LLC. You want to keep it separate as far as liability, as far as managing it with regulations. Yeah, we want to keep it totally separate. But we take care of all that for you, so you don't have to worry about it. I think last year I probably incorporated at least 30 LLCs between real estate and healthcare.
What about for us getting started here in Philly? Like, we're all gonna use the house next to yours down as our hub.
Mhm.
So like, is there a requirement, like you have to be, because we're starting out non-medical, is the requirement you have to be working there, like in certain hours or?
Well, it's like a shared space.
Yeah.
So there's no regulation saying you can't work in a shared space. So the plan is to have someone there if someone actually does stop in, like say if auditor comes in,
Yeah,
most of the time they contact you. when they do contact you, they probably will say I'm coming the next day when they actually are there that day. So you wanna you wanna just have somebody there and just say you're not available, or you're out in the field. It's okay to be out in the field.
That happened to me.
Yeah, you weren't there.
So I have a virtual office, but I have the virtual full office.
Uh-huh.
So she called on a Monday, said, "Hey, I'm just letting you know we're coming sometime this week."
Okay.
So I'm like, "What day you gonna come?" I just thought I just asked her. So she was like, "Well, the nurse said we can't just tell you what day we coming, but I'm basically telling you, come." I had something to do one particular day, so I said, "Is there any way you cannot come this particular day because I really have something planned next month?" She said, "All right, I'm gonna do you a favor. I'm not gonna come until Friday." That's what she said. She came the next day.
Wow.
So my secretary called me, and I knew I wasn't gonna be there because I'm thinking she told me I'm coming on Friday. So she actually came the next day, but they do want to see something like the secretary there to say like, hey, they want somebody who's knowledgeable, kind of sort of. You know what I'm saying? They don't have to like the secretary doesn't know like our business per se in and out, but they have to have somebody there,
Right.
especially during your business hours. So I could say, so for instance, my business hours were from 9 to 5.
Mm-hmm.
But next time going in, I think I'm going to change my business hours to maybe like 12 to 3 in the office or on call at a certain time because they're going to come those times that you put for your office hours.
Exactly.
And they can come anytime during the time.
Yeah.
Right.
Yeah. So you just got to be like creative with your, like, just like you said, you can be in the field. It's not like you have to be sitting in your office 24/7 because how do you want to get the job done? They're not really on like what you do in your daily office. They just want to make sure you're following regulations and
That's it.
sending people out to sort these people out.
Right.
So what happened with the follow-up when you weren't there?
I was like, I'm at the doctor's. And the other days following, I was there every day waiting for her, but she actually came on Friday.
Cool.
And it was fine.
And you don't want to, and that's why early on I made sure everything was online because I wanted to make sure I'm able to sort through information, answer any questions that they probably have a question on. Because the longer you stall, the worse it gets.
The first thing she asked for was the regulations. She wanted to make
Yeah.
sure that we had the regulations there, and then they go through your charts, and then you got to leave them, and you spread everything out, and you just go.
Right. So yeah, my first round, I did that. I hated it. I actually hired people to help me. It was a headache. And then the next time, everything was online. They gave me random dates. They said, all right, September 5th. I want these staff that were working at this day with this consumer. I want to see all their trainings. I want to see the documentation. So I was able to just do a quick search in the application. And so that's when they were like, oh, hey, this is great. I like this. You should share this with other people. And that's when I was confident enough to move on more. Because if they're happy, then that means who cares what anybody else says? They're the ones who, yeah, that's all that counts. It doesn't matter what a family member says, an advocate says, you're in compliance. That means you're doing it right. So if you have the okay by the actual auditors, then that's all that matters.
So how will it work out then for Teresa or other people starting other states? Like how does their office look like? Like what is the route for them?
Same. The hub, we start off with the hub. If we don't start off with the hub, again, you're able to start off with a shared space, like a WeWork or something like that. Early days to just save on. Some people I suggested to just, you could always rent out a room if you don't want to, or use your own home starting
I
off.
thought you could for non-medical use your own.
You could use your own home.
For license, you can use your own room for license. Yeah. The thing about it is like I said, I started off with, I've been in business for a year. I started off with a virtual office. I actually prefer an office that I can walk into 24 hours and just in case anything happens. Just in case anybody calls, I know I can get to whatever I need to get to versus my virtual office, I have to set up a time to use my office. I get free hours, but I have to set up a time to be able to use my shared office space versus me having my own. Like, so for instance, the hub 2 doors down.
Yep.
You can have access to it at any time because of things. But it's hard when, like, I'm actually in the building on Albala Kenwood. They're not open 24 hours. And I just have a secretary, but they don't know the ins and outs of our operations, and it's easier to have your own space that you can get to, and you're able to pull up anything you need to just in case somebody calls.
Cool.
So I'm looking to switch that over.
Cool.
Yeah, so I mean, are all of us sharing the space in that?
Yeah, there's no limit that I could think of as far
I was
as.
just thinking about Oleg, who's far
I
away.
believe he's using. What are you using our space here? I believe you have a different address on profile. Where do you want your office to be? Are you using your home office right now?
Right now, yes, I wasn't quite sure what to do about that.
Right. So you can have your own home office, or you can use our shared space right here. So you have options because we have a hub here already established. So
So for
it has
my
office
so for my
space.
business,
Yes.
Yeah, remember when we went
Yeah,
to
yeah,
that
yeah,
house
I
in the
know,
bottom
I know.
underneath the desk?
I'm just thinking about in terms of like, how often I need to make it up here,
Right.
mail and all that stuff.
Yeah.
Right.
Just from like the how practical it is.
Right. Well, as far as mail, I want to have that option where you could, if you allow us to, I could have somebody scan. Something like that.
That would be the option for me, probably having it up here, change it.
Oh, it's just convenience. Save money because it's included. You don't have to pay for an additional space.
But if we have a home office, like set up, like there's already a designated area in your home, you could alternatively use that space as
Right.
well.
Right.
But in terms of like, you were talking about audits and stuff like that. So
Right. So it'll be more ideal because I'm
Ideal,
gonna be in the area. So at least early days, I would say try to get in the hub.
Okay.
Should we change our address? I mean, I think our license address is our home address right now. Should we work on changing that now?
Yeah, we can because we didn't submit anything yet. But yeah, I could support either.
Just when you your home address, you got your disclosing your home address to go into
Correct.
the home for any. You have some that want to come out to your office.
Yeah, you don't
So
want
do you want
to.
them to come into your home or is it like a real office?
Yeah.
Yeah.
I
So,
got it. I'm in.
Yeah.
I'm sold.
Good point.
Yeah.
and then Dennis has that.
Yeah,
thing
we
in
did
the
we did an extension, so it's like an additional space. So for trainings or meetups, additional
I'm in
space.
change.
It's like another 800 square feet.
That's easy. Because I don't want to
Especially when you know
people.
you got it for free. Like it's different when you have to pay for certain locations and you starting off, so you don't want to put a big expense out when you first
I
started.
didn't realize that was our hub. That's what I know.
Yeah, in Philadelphia, this is our first hub. We have another one that we're establishing on Temple campus. So I'm finalizing that right now. There are a lot of properties that I wouldn't say given to us, but they're available to agencies. So I'm trying to figure out who has the best proximity to there. But anybody, no matter which state you're in, if you're able to just use your home office that first year while we're establishing your hub, that'll still give you the opportunity to, have that office location as well.
I think it's kind of cool too. I mean, I'm weird, but I'm like, I think it's a cool think tank for all of us.
Oh,
like,
yeah.
We're all going on
Totally.
this new,
That
like,
keeps
we
us
can all
all
like
together.
Totally.
utilize each other, even though it's
It's awesome. Got a little
Yes.
more process there.
Yes, and that actually leads me to this.
Yeah, exactly.
If you bring up dogs. No.
Yeah.
The interdisciplinary team, you're not going to be, there's no regulation requirement to actually have these as actual employees. So that allows us to create like a on-call per diem type system within Optonome to, based on the schedule that you create for that particular patient, we're able to find the staff for you. Again, you have final say as far as who you want to provide the service, but we'll be able to create a pool with these people as well. Like again, we want to keep the cost as low as possible, so there's no need to keep them on full time or anything like that. And with telehealth, a lot of these I would say a dietitian doesn't need to be on site all the time. The data's in the application, so we could quickly share information with them. The social worker, the primary care physician, a lot of the PACE organizations, they only see the primary care physician once a month. So if you have maybe 20, 25, 24 patients, maybe you'll have a doctor on site maybe 3 times a month or something like that. Cool. Any more questions on the PACE? I think it's an amazing
Is that any
opportunity.
different than, have you ever heard of a CORF?
A CORF, no. PACE is also called a life organization.
I know daycare getting their CORF certificate right now.
CO.
COR, certified outpatient.
A comprehensive outpatient rehab facility is a medical facility that provides outpatient diagnostic therapeutic restorative service.
And there's a daycare center in Northeast. Probably getting one of these, which is interesting.
A fixed location to outpatient rehab. Seems like it's a little more limited
More limited than.
than a
Oh wow.
than a PACE. Yeah.
Okay.
Because it's everything. A PACE is everything. It includes home health care. It includes going out to a facility.
Yeah, I
It
just
includes doctor.
just lost a patient that was a referral, and she was a Medicare Innovage.
Okay.
And she I was going to bring her on one of the home care agencies that I work with, skilled home care agencies, and Innovates just had it all.
Yeah.
From like A to Z, they had it all.
They have it all, right.
All levels of care were covered.
Right.
Including daycare.
Right. Cool. So yeah, it's definitely exciting because you're establishing that core right now. So that's cool. Cool.
So
I think I
that's
covered
another
everything.
thing too that I'm interested in as we're all progressing. It's like, are the sport coordinators going to know like, oh, this is another autonomy,
That's what we want them to know.
Yeah, that's what I'm saying. Like, should I start? Like, somebody
No,
should
not
have
yet.
this?
Not yet.
Okay.
Not yet. We want to.
Because when we get the cover,
they're like ready with referrals, so if you want to be like ready to take them, like for marketing purposes. Like you can get your name out there, but they're kind of like so. Say for instance, like I got all my clients have coordinators, but if I wasn't approved yet for one of the MCOs, they'd be like, all right, so why are you contacting me if you're not ready?
Mm-hmm. Right, they're ready to go.
They're ready to go.
Yeah, they're ready to go.
Okay.
They're ready to go.
because the only question I have for that is like, we're all gonna give out our brochures, we're all gonna give out our cover letters. They're very similar. So that's why I was like, are they gonna start to be like, this person? I mean, I don't know if they like really look at it like that.
Regardless, you're still different from all the other agencies. So,
Well, that's what I was wondering too. Like when we go out to see me and Kyle are like, he's a behavioral specialist. We're like almost right there. So I was like, should we go out together and then be like, hi, like he's a behavioral specialist with his clinic, I'm an OT with mine, and we're going to utilize each other as a clinical network. So would we look better because we have like this clinical offering that we can do, and we're coming in together to show that like we have different businesses, but we're coming together.
definitely, that's definitely an added advantage. But at that point, they're just going to ask about where you're located. If you're located in the same place, they're going to like, or if you come in like with another OT, they're like,
Yeah.
yeah. But if you go with Kyle, I think they'll be fine. They would like, wow, this is amazing. Yeah, I don't see any drawback from that.
Yeah.
So when the referrals come in, how do you what's the plans to disperse them to the different
So the referrals come directly to you. It's up to you to upload it into Optonome, and then that's where we start to break it down and create trainings and evaluate it. So, but it comes. They still use email. They still use email, so they're going to forward you the ISP through email, or maybe right now they probably say, "Hey, go to the site and download it from there." But you have to be.
Did you mean? Is that what you asked?
She pretty much. I asked something different, but he
You
kind of
asked something different. Yeah.
because I had to think about it. But he just said because the referrals are not going to come to Autonomy. They're actually going to come to our business.
Yeah, I kind of answer what she wanted. I think.
Yeah.
I was just trying to follow.
Yeah. In my mind, I was thinking about
That
it
was a
backwards.
good. That was a good question.
Yeah, the so we market on your behalf, but at the same time, the support coordinator or local entity, they're going to send it directly to you because you're the authorized agency. We're just your technology vendor. We still got the BAA agreement in place where you are allowed to, with the BAA agreement, to upload that information because it's HIPAA compliant.
Sure.
Because it's still consumer choice. So
Yeah,
at the end
no, I
of the
got
day, we all could be with Autonomy, but if that client wants to be with Shayna, they're gonna go with Shayna.
Right.
But we're all on the same.
How much of it is location based?
Where they want to live,
Right, or like proximity, like
to family.
family, right? Like is that that's obviously
I think that's up to
important,
their
right?
choice, like maybe they provided like a list from their support coordinators, like here are the agencies, the addresses.
I think is location first, and then the types of services that you can provide. I've had people that traveled pretty far, like central Pennsylvania, to live in our 24-hour homes. So they definitely would travel if it's not there. And with the types of services you all will be providing, people are going to move. That's like somebody going to school at University of Penn, that lives across the U.S. They're going to go to the school because of what it can offer them. And that's what I'm trying to establish for all you guys. Establish something that they can't get anywhere else.
So how would that help, like me and her, so we want to be in different states?
Right. So we're still able to put together a clinical team. You're still part of the entire network across the U.S. So even though they're not directly there with you, you can still, you'll still be able to connect with other people and provide the best services. The types of trainings that will train the staff that will provide the consumers that are going through your agency will be the best trainings across the entire U.S.
But you're still gonna get your referrals as your own business.
But you're
going
going
to
to
be a part of the Autonomy.
right provide the best.
So as far as like the regulations and all that stuff, you have to make yourself aware of, so you help us start the agency.
Yes, I build in the regulations into the app.
Okay, for like I said, so if I want to get started in Delaware,
Yes.
do research.
Yes. So I like I said at the beginning, I use my government experience to really do a deep dive.
Yeah, I started, like I said, with another company where I'm going through different trainings and different stuff to be able to supply my staff with certain things, like the medication administration, stuff like that. And I know some of it on as far as like the Delaware level, but it was just like, I know she was coming on with Autonomy, and she mentioned it to me as far as basically doing the facility aspect of it.
Right, the 24-hour care aspect. Yeah.
In home. Because I already have my own properties in Delaware.
Okay.
So that's basically what I'm interested in.
Yeah. So as far as people that have their own properties, I'm totally open to you having your own properties. But I still look to make sure that it's an area that you can expand in, an area where consumers want to live. Like, is it close to a park? Is it close to public transportation? Is it close to restaurants and shops where people can age in place? So I look for that type of stuff, and especially so it could be self-sustaining. So people could want to rent it. So people do want to come visit in the Airbnb. We get people here coming from Canada. So we want to make sure it's a nice place that people want to come to when they're traveling. So I don't know where your area is.
And what about the corporate structure? As far as I know everybody's saying, we'll start their own LLC, but what if we want to do nonprofit?
Yeah, you're always welcome to do a nonprofit. Why not? Most nonprofits have a slight for-profit arm
Right.
because they can't always depend on donations.
Yeah.
So, yeah, you definitely could do it. I actually think everybody will eventually have a nonprofit.
Because I'm just looking at like what you brought up as far as the PACE entity. You know, if that's the way that they're moving into, if you start the nonprofit, you get more as far as grant money and all of that stuff. Even if you have your for-profit arm.
Yeah, that definitely could be an added option. For these types of programs that CMS is like leaning towards, again, you'll have the infrastructure in place. So no matter what comes down the pike, you'll be ready for it. So that's why something like this, you already have the core in place. And that's why I help everybody establish services for adults with autism and intellectual disabilities, because there's a need forever for these types of services, and it's not easy. It's not easy. You need to be able to train these staff properly. You need the right oversight. But it pays very well if you know what you're doing. So with that type of profit margin, you could do these types of other services or create affordable housing opportunities like that.
Yeah, and in case you guys are wondering, Optonome is now in I think 15 states so far. I have to double check. We just got Utah.
I think it's about 19.
19?
Yeah. This is a lot of work from my part, but it's kind of exciting. Learning about how all the different states are behind, how we'll eventually help them with their regulations, how each one of you are unicorns in your respective neighborhoods. Like, families are you're gonna be getting honors, because nothing like this is really in the area. When I started, the whole Eastern Pennsylvania, they were like, wow, you can actually provide housing to help people transition out of institutions, or help people age in place. This types of offerings.
Did you ever tell them your experiences when you had Amy there?
Which part? I try to share as much, but nobody asks me questions, so I don't know.
So how do you do as far as like, let's say if you have those people that want to go live in the community, being as like, let's say you don't have your own property, how do you go about getting, like I know companies that rent out apartments and have the individuals living in apartment complexes and stuff like that.
Right. So that's what I call the Fresh Start program, because when they want to do that, they can't afford it because they're on a fixed income. So the only option at that time is, okay, if you want to continue to provide services, either you help them find a home with a local apartment or third party, or you could set up a home that you own or something like that, where you could subsidize their rent. You can even subsidize their rent when they're renting from somebody else, kind of like Section 8 housing. So that's what I used to do. I used to do Section 8 housing. So that's where I really got the idea of subsidizing people's homes. Hopefully I answered your question.
So the residents that you had that was living in your properties, they were Section 8 was paying for their housing?
No, they were on a waiting list, because the waiting list is years.
Yes.
So we were providing community inclusion services. I believe there was some I had someone in Chester that we were doing community inclusion and supportive employment, where I had a staff going out to, he worked in like a kitchen or something like that. And community inclusion services where I even took him to like an outing once to like a bookstore. And we subsidized his housing maybe about, I believe it was about $600-700 a month. His mother paid the difference, something like that. So yeah, it's definitely opportunities that families do want.
So I have a question, like in certain markets, housing is more expensive and stuff.
Right.
What if you're trying to establish a hub in a city that is expensive and you can't find investors who will get a property? Like, what would be your plan for a CEO?
Right. So in 2000, it's about 2 years ago, 2018, I think, I created a fund that allows us to purchase properties independently, where people in the local community can actually invest in the fund, $250, like dirt cheap, where you can own part of the home. So this is probably the most expensive home that I found, because I know that other areas were probably just as expensive. So this is probably upper limit of about 500,000. Yeah. So I figure other markets, worst case scenario, we could be on the expensive side of 500,000, but I don't think I would go any higher, because it would probably be just like a break even at that point. But yeah, if that area is just too expensive, we would just go a little bit further out. The reason why I ask for how far people want to travel is, as transportation gets more and more cheap, we're able to provide transportation between hubs or between cities, major cities, in a hub that we can establish. 30 minutes could be 60 miles, depending on traffic.
But do you think she should find out like what the reimbursement is before she pick whatever house in that area? Like she said, like say if it's a more expensive area, if she wanted to even rent a house to use for that time, should she look at the reimbursements for what the state is giving before she purchases a house to put people in?
Well, yeah, we don't really establish a hub of this size until we were confident that it could be, consumers could live in it. Like starting out, we would probably just start off with one home or one apartment in an area that we know we can expand upon. So we don't really take on too much risk early on. Yeah. Yeah, any more questions? Any more?
At which point do you actually start to look for properties? Like in the licensing process?
I do an initial one to just assess the area. It takes me about 15 minutes. And then I don't, any real estate investor, they don't look for houses unless they're ready to buy. So I'm not 100% confident that we should start purchasing a home until you're up and running. Yeah, at least till up and running. Because worst case scenario, we could rent from somebody else. Yeah.
Do you want us to have clients at that time, or
yeah, you can,
or getting ready to have clients?
You could, your first couple of clients, I'm pretty sure they're probably living with a family or some other type of housing option that's too expensive. So they're looking for some type of better option out there.
So basically, as soon as you're approved, and as soon as you're approved, and maybe even receive a referral or something like that. Is that,
Yeah.
let's do this.
Yeah, because that's when your name is out there. They're starting to know the types of services you're offering. That's when it makes sense to start to put it together. Because then you could say, "Hey, we have the hub that's opening up soon. Coordinate with other consumers and provide these types of activities in your local community. We're putting together this 2 to 4 year program where you're able to receive services by an OT, PT, speech language pathologist, and behavioral specialist all throughout the month." That's the wow factor right there.
So where's Shayna? Shayna, where are you at in the whole process right now? I know that you just got approved and everything, and this is your space right here. So you waiting for something else?
I still have to, so with my autism waiver, I got the supportive employment approved. I'm still waiting on community inclusion. So after that, then, I already started, I finished my brochure, I got my business cards, I emailed the support coordinator, so now I'm just waiting for community inclusion.
Is that, we should start too?
Yes, that's the separate training.
Yeah.
Right? They show us in the beginning. Community, is it that community participation?
No, that's on the consolidated waiver side. On the autism waiver side, no, you did. You took it already, I believe. It's the on the autism waiver side. It's the skill building.
Yeah.
Yeah, there's the lowest rate is the $9 per 15 minute, and then you gotta step up one where you actually could do a skill building plan, and then another step up with the behavioral specialist. So those last two, they're brand new as of like the last 2 years. Before it was just community inclusion. So Shani, you probably want to take that. Yeah. The good thing is we have plenty of behavioral specialists to help you qualify for services. So that's the benefit of the network. We could help you qualify for more services by having other healthcare professionals in the area. Cool. Just like you all, if you want to provide services for the PACE program, we have nurses here. So we could easily add them, and they could have additional, they could be advisors, or they can actually provide the services for you, their choice. Cool. Any more questions? Anything you want to add, Shayna? No?
Definitely want to get a picture of all of us.
Yeah, I know
So
you're gonna
meet
say
up.
that.
That's my thing.
Thanks for joining those that are online. Yeah. Yeah. I decided to send the brochures out to people I know, because I want to see what they're gonna like, how they're gonna respond. Like, just kind of test the waters first, and then start to really call them and say, "Hey, look, we used to joke on the phone all the
Do
time."
you have like the autonomy symbol on your brochures?
No, I can show you. that if
No,
you'd
not
like.
at all.
No, it's your own business. There's nothing.
Yeah, I
But
don't.
I'm saying, like, would it be? In other words, like a partnership. So if I had, like, if you had your brochure, I had my brochure, and it's like, oh, this is a part of autonomy.
We could probably just put the logo or something like that on
I
there.
think there should probably be something that
Yeah.
is part of our time.
Sure.
Because you are building like a brand that's gonna.
Yeah.
Right. I'm okay with just the logo.
You can slide over to like.
Like part of the autonomy network.
Yeah, we do talk about the network on the brochure.
Okay.
Yeah.
Okay.
Yeah, that's
So that was
exactly
one
that
that,
makes complete
that
sense.
makes sense.
so then once
Yeah,
I
we
get that,
it's
once I get
clear
solid,
because we want people
I'll
to.
keep my brochure and
That's the
we'll-
added
I'll
advantage,
Yeah.
in a fragmented industry, to be able to connect with
And then
one
once they
another.
go medical, then I'll add,
Yeah.
therapy services on there. Oh, yeah, go for it.
When you said that you were waiting for the community inclusion, is it that skill builder?
It's a skill builder.
So you're still waiting for that skill builder?
Yeah.
Yeah, so there are two different types of service types. So there were two different applications. For
Yeah, I thought they
for
were
some
going together.
odd reason, they only approved one.
And it was supported employment first, which
Right.
is like a bummer, because,
Let's support the one first.
Right.
yeah.
Yeah. So I mean, the other one should be approved pretty soon.
Yeah, it says it takes 60 days, so I hit the halfway mark. They said 60 days or less, so I'm at day 30 right now. It was February 2nd that it was sent out.
And again, you don't want to provide one of the two services, because then they're going to go to somebody else for the other service. So there's no point in.
Yeah, I'll update that on the group so you guys can look at it, but
Awesome. Looks good.
I took some from Dennis, and then I took some from Kyle, and then Kyle took some from me and Dennis, and now Liz is working on hers.
Right.
So it's just like.
And that's how it should be. You should everyone be able to collaborate and take ideas to whatever you like.
Yeah.
Or I'll just create a default one.
Yeah. In case you're wondering, Canva is a really good
Hi,
program
Mariah.
to like make stuff.
yeah.
So that's all from.
I used Fiverr.
Fiverr.
Yeah.
That is no longer $5.
No,
No.
It's
No.
Fiverr's gone.
it's still cool though, relatively. It's
I
just
mean,
nice.
I was using Fiverr when Fiverr was $5. That's why it
Okay.
was called Fiverr.
Yeah, exactly.
Because it was
Yeah, that's
$5.
fine.
Everything
Oh,
was
really?
$5.
$50.
Now it's $50.
Is that well? Is that it depends on what you want done, but It's like
Yeah, but
my
literally
first
everything
meeting.
is $5.
That's awesome. I think that was the time, they didn't really want to.
Nah, yeah,
That's kind of shared.
But yeah,
Right around when like Craigslist was huge, when it came out.
Hi, Terry. Hi, Robin. Hi, Mindy. We got a couple questions here. Are there restrictions as to how much money they can make or it interfere with the Medicaid payments? Are we talking about the PACE?
You have non-skilled.
Oh, more
And
questions.
so home health aides.
Terry, this is related
And
to
you're trying to
PACE.
get
It's a capitated payment per month. So no matter whatever the services that need to be provided to that consumer,
A couple properties up here, so my goal is to have them within my home.
it is covered. Can't
But I'm
update
gonna
that.
pull all this stuff. It's more lucrative, but that's my
Is
goal.
it possible to manage your home remotely? Yes, I've done it. And spend a specific amount of time at the home. Yes,
I
I've
mean, you
done it.
get the other community things too, but that was his main thing. I loved every part of it.
Everything is muffled. How come I listen to a more clear? Oh, I'm sorry,
What
Robin.
he had was also a non-skilled.
This program is an
Yeah, it was-
a community
Same thing,
renovation
24 hour,
advocate who helps people move from out of nursing homes into community-based housing. Where can I find out if there is an organization in Illinois? Just search.
Skilled, like,
No, not skilled
Also,
part nursing, but he did
Could I
autism,
please
intellectual
contact?
disability.
Yeah, sure. Hold on.
But me and her are actually doing the home health in Delaware still. We're both the RN.
Oh, you're
Cool, you're OT.
Yeah.
Wow.
So Delaware is not that many down there. So it's like a good market to jump into.
Yeah, actually, one of my friends' dad.
All right, Mindy. So the DSP,
The
the DSP is an
Okay,
independent
cool.
contractor or a separate entity, where similar to how you. So the DSP I got for. I think I recently. It's kind of weird looking at myself again. DSP could have their separate entity, kind of like most agencies these days, where they work with like a staffing agency. So the DSP could very well have their own LLC where they're the only staff in that LLC, or they could be an independent contractor. So I explained having an LLC and like a staffing agency LLC because in California they're starting to put restrictions because of Uber and Lyft. And I don't want to limit DSPs because they're already getting paid low wages. And so through DSP 123, they get trained in multiple jobs and not just healthcare, but real estate as well. So they're able to eventually learn how to do a home inspection. That career in itself is a $70,000 a year type job. So
After only having a high school.
yes,
degree,
there's no
right?
degree requirement to be a home inspector. And so we at the core, we want them to be able to learn how to care for somebody. So that's the first thing, because if more people out in the community that know how to provide care, there's more people in your pool. So they have multiple jobs, so they don't want to be an employee. They don't want to be an employee. They want to be able to set their own time, be able to deduct what they're doing off their taxes so that their take home is more. So it's a different type of approach that the industry is leaning towards. That's what people have a lot of call outs. You're going to have staff that are burnt out. They're working with people that they don't want to work with because they're not skilled at everything that's needed for that consumer. Consumer on a given day could work on maybe 3 to 5 different goals. That one staff member is probably not the best person to work with them. All right, we got another. Yes,
But
Mindy,
would it
your
be hard to
agency.
get a DSP on that level? Because some people, they look at it like, okay, I'm coming to care for this person. They don't want to do a whole lot of extra, like because of just like you said, the rate. Is it easier? I mean, I understand like the call out. I understand all that part, but it's easier to get is it harder to get the mindset of people to be an independent contractor versus
Right. Good question. So when I started the shift, this was like 2015, 2016, it was hard because people were like, what? You want me to be like, you want me to like do this stuff on my own? But then I started to like teach them about entrepreneurship and how they'll be able to save and how they will be able to earn more and how we're giving them the tool to actually manage their expenses. Then they started to understand it. But from the beginning, that's why I created DSP 123 to really teach them about entrepreneurship and why it benefits them to provide care and be independent. Because otherwise, they're so stuck, or that's all they know. They don't understand about small business. So this is more like an accelerator for them to understand business and be the best that they can be as well. Because I don't know how this was being done before, but I don't know how you could pay someone close to minimum wage and have them be motivated to motivate somebody else. It doesn't make sense. Right, it doesn't make sense. So how,
So the goal is to like start them at like, this level, progress them up to, a different level, and then there's going to be almost like a constant flow of
Right.
DSPs. And
Right. That could potentially be healthcare professionals as well. But we want to expose them to the industry and the opportunities. Right now, it's non-existent.
Usually home health.
I think it would be having a
No,
higher rate.
DSP now.
And also too, like,
Once you
like
feel like you start
they're
getting
gonna
them
be
trained
mentored by
and
us.
then
And
you tell a friend.
Kelsey, not sure if you had seen my resume, but I have worked at a PACE. That's cool, Kelsey. And still PRN. So interested in this in the VA, Tennessee side. That's very cool.
But I know,
The program I work for did not offer services for ID. I'm telling you, it's a game changer. It's
Right,
such a great program to help the participants, clients, age in place, and go out in the community. I have been on many outings with PACE as part of the therapy team, as well as adding the ID autism population to the meeting. Awesome. How about other groups in therapy? Talking about on the PACE side, Jim, actually they're very involved. They want them to be, as far as parents or family members, they want them to be more involved. As they're also care team members and also can provide support services. So in addition to your PACE organization, they'll be assisting when they're at home. And if they're not available, you'll be able to provide DSPs to the patient or consumer.
Yeah, I just had like somebody I was trying to refer to an agency and they were like not willing to. They wanted to switch an agency because one agency was paying like $1 more now or something like that. But I like your approach where you're just like, here,
I personally haven't lost anybody yet. But then I could also say I have family members that care for other people, so they ain't gonna go nowhere anyway.
Any more questions? I'm about to log off. I was just reading questions on Facebook.
But like fast food restaurants is paying just as much. So,
Yeah, exactly.
I feel like
Thanks for joining, everybody.
I feel like